So good morning, everyone, and thank you for joining us today for this hearing. I'm Amelia Boyd, and I am the program manager for the commission and the organizer for this rules hearing. The hearing is being recorded and will be made available sometime in the next week on our YouTube channel. The documents which will be discussed here today are on the calendar on our website, which is wmc.wa.gov. This hearing is being held in a hybrid format with virtual and in-person participants. Here is our hearing agenda. Before the close of the hearing, we will discuss, next steps. At this hearing, the commission will listen to testimony, discuss written comments, and vote on the proposed language. When the hearing is open for testimony, please keep the following in mind. The commissioners will only consider comments directly related to the proposed rule language. If your testimony falls outside of this rulemaking effort, you may be asked to hold your comments. You will have approximately 2 minutes to speak. If your written comment is included in the hearing materials, it has already been reviewed, and any relevant comments will be considered by the commission in this rulemaking process. So I will now begin the roll call of panelists and staff. When I call your name, please introduce yourself. So first, we'll start with the online participants. Ms. Blake.
Good morning, Christine Blake, public member of the commission.
Thank you. Dr. D'Souza.
Morning, it's Dr. D'Souza. I'm one of the commissioners.
Dr. Jager.
Good morning, April Jager, Commissioner.
Mr. Pullen.
Douglas Pullen, public member of the commission.
And we'll start with those in the room. Dr. Murphy.
Dr. Terry Murphy, Chair of the Commission.
Good morning, Ed Lopez, PA Commissioner.
Dr. Elisha Fundura, Commissioner.
Dr. Lyle, go ahead.
I'm Dr. Sarah Lyle, Commissioner.
Dr. Curry.
Diana Curry, Commissioner.
Dr. Pushin Chang, Commissioner.
Scott Rogers, public member.
Micah.
Micah Matthews, Deputy Executive Director.
Okay.
Kyle Kiernan, Executive Director.
And then Mr. Bucknell, since you've been able to join us, could you go ahead and introduce yourself?
Sure, my name is Jack Bucknell. I'm an Assistant Attorney General covering for Heather Carter today. I'm sorry for my late arrival.
No worries. Mr. Bailey, go ahead and introduce yourself.
Michael Bailey, Public Commission member.
Thank you. Dr. Domino, if you'd like to introduce yourself and then begin the script.
Good morning, everyone. My name is Karen Domino, and I'll be the presiding officer for this rules workshop. Today is Friday, March 13th, 2026, and it is now 9:46 a.m. This meeting is being held by a Teams webinar and in person at the Department of Labor and Industries located on 7273 Linderson Way Southwest in Tumwater, Washington. The proposed rule being considered today is establishing the use of nitrous oxide in office-based surgical settings. For today's hearings, all comments will be summarized and a summary will be provided as part of the CR1-103 rules package when filed. Please do not interrupt individuals who are testifying. This hearing is conducted in accordance with the Administrative Procedure Act, Chapter 34.05 RCW, and is being recorded for the official record in compliance with its requirements. The proposal, or CR-102 rules package for this rulemaking was filed on February 4th, 2026 at the Code Revisor's Office as Washington State Registrar, or WSR, number 26-04-130. Are there any questions regarding the rule or the hearing process before we begin the testimony? Please note that the questions asked during part of this hearing are not considered testimony and will not be included in the rulemaking file or record. So
There are no questions.
no questions? Great. The proposed language for this rule is included in the meeting packet and is also available on our website at wmc.wa.gov. Ms. Boyd, could you please provide an overview of the proposed language?
So we're making a small change to section 246-919-601 in subsection 3 under exemptions. This rule does not apply to positions when they're using nitrous oxide under the requirements which are in the new section 246-919-603. And then, so the proposed new section applies to non-accredited offices using nitrous oxide at less than 50%. It includes trained physician and separate practitioners who administer and then monitor the sedation. There are many items about patient safety, including vital signs, emergency equipment, and a hospital transfer plan is required. It speaks to discharge, and it talks about how you should only discharge when the patient is alert, stable, and mobile. And then there are pediatric safeguards included. And then there are options for removing or monitoring nitrous oxide in the procedure room.
Finished? We will now begin the testimony portion of the meeting. When testifying, please focus your comments on the content of the proposed rule. When you testify, please state your name, the organization or individual you represent, and whether you support or oppose the proposed rule. For those attending in person, we will invite you to testify in the order in which you signed in. If you wish to testify but do not have yet signed in, please do so now. If you are participating virtually, please use the raise hand feature when you're ready to speak. We will call on you and unmute your microphone. Each speaker will have 2 minutes to provide testimony. If your written comments are already included in the hearing materials, they have been reviewed, and so we will ask that you not repeat them during your testimony. We will begin with those present in person and then move on to virtual participants. I'm now able to open the hearing for public testimony. Ms. Boyd, is there anyone here from the public? And if so, who's the first person signed in to testify?
There's no one signed in to testify. Did anyone need to testify that's in the audience?
Okay.
No.
Well, if there's no one who wishes, and how about anyone else wish to testify from virtually?
If you're on virtually and you'd like to testify, please raise your hand. Dina Levin, go ahead.
Good morning. My name is Dina Levin. I'm the medical director of women's care at Whidbey Health on Whidbey Island, and we're really looking forward to using nitrous oxide in our office. And I think that this current rule has struck a really good balance between safety and just ease of use. And I'm really happy that hopefully we're going to move forward with it today.
Thank you. Does anyone else wish to testify? There are no other hands raised.
Okay, well, if no one else wishes to testify, I'm going to close the testimony portion of the hearing. Has the department or commission received any written testimony from members of the public related to rules filed under WSR number 26-04-130?
We did receive a couple of comments. They are in the materials and they were in support of the rule as proposed.
Okay, commissioners, you may now discuss the relevant testimony and the written comments. Anyone have any discussion? We did modify it according to the public feedback that we received the last time. And I think it's a reasonable product myself that incorporated all the things that we needed to incorporate. Okay, so there's no discussion. No one has any comments. All right. If no revisions were made to the language, would the commission consider a motion to adopt the proposed language as presented today?
Motion to adopt.
Second. Great. If that passes, we have to vote, right? Yeah.
That's what you're doing right now. Yeah.
Yeah.
So all in favor?
All in favor, say aye.
Aye.
Yeah.
Aye.
Anyone opposed? Great. All right, the motion passes. Ms. Boyd will now outline the next steps and explain how to participate in this and future rulemaking efforts.
So the next steps in this rulemaking, now that it's been adopted, is that we will file the CR 103 or the permanent rulemaking documents. The testimony and written comments responses will be included in the concise explanatory statement, and these rules should be effective sometime this summer.
Okay. So, we don't have anything else other than thank you for your participation. The hearing's now adjourned and the time is 9:54.